Welcome and thank you for joining us for the Lunch and Learn exercise for Frailty. My name is Natalie and I'm from the PHN Education team. I'm joined today with Jake Maven, Commissioning Coordinator, and Steve Riley from Rural Fit in Tamworth. Before we begin, I'd like to acknowledge the traditional custodians of the land of which we live and work. For myself on the Central Coast, that is Darkinjung country. I'd also like to pay respects to elders past, present and emerging. Now over to you, Jake.
Thanks, Nat. We're really happy to have Steve here talking about the critical relationship between frailty and exercise. The topic was requested as an extension of the work done in the frailty space to further support our ageing population. Over to you, Steve.
Thanks, Jake. Thanks, Nat. Okay, so what is frailty? Frailty is a medical condition characterized by a decline in physical and cognitive health. It often occurs due to a combination of deconditioning and acute illnesses, leading to an increase in vulnerability and difficulty recovering from illness. It's more common in females, and approximately 25% of patients aged 70 and over are affected. The characteristics of frailty. So essentially, it can reduce physical function. So often we observe weakness within the muscles, leading to slow gait patterns, low physical activity function, and becoming easily exhausted, poor endurance, and unintentional weight loss. Okay, frailty is considered a dynamic state. So essentially, this means that it is possible to improve the condition, but also there is possibility of it deteriorating. What are the causes of frailty? So the most common cause is age-related decline. It's often associated with the normal aging process when multiple body systems gradually break down. It also may happen as a result of underlying health conditions. So those people with chronic disease such as cancers, arthritis, heart disease, things like that are more susceptible to developing frailty. Your lifestyle factors such as poor nutrition, inactivity, social isolation, and certain medications can also contribute. What are the consequences of frailty? So as mentioned, we're at an increased risk of falls, leading to more hospital visits. Mortality, so where there is a higher risk of death associated to frailty. Poor recovery, so individuals that do suffer from frailty are more susceptible to being aged care facilities and more longer term arrangements. It has an increased healthcare costs, so it puts a little bit of a burden on the healthcare system as well. It can lead to muscle loss, which often is the progressive loss of skeletal muscle and strength, which also impairs our function. So that will lead to more falls risk as well. Okay, so how do we manage frailty? Essentially, frailty, in order to be diagnosed, there is a couple of comprehensive assessments that will take place. These are often brought up by the GP or other allied health. This looks at the medical, functional, physiological, social needs, and also there's some scales, so such as the Frail scale that the GP or other allied health can conduct to assess your diagnosis there. The personalized approach is interventions and tailored exercise programs, which we're going to delve into a bit more today. But yeah, essentially we're looking at a bit more of a multidisciplinary care. So collaborative approach between your GPs, your exercise physiologists, your physios, and other allied health there. Frailty, we're trying to manage this through addressing underlying conditions. So as mentioned before, we can look at declining the progression. So we want to do that through exercise and other interventions as soon as possible to eliminate the risk of fertility occurring. Okay, another couple of things. So management, we're looking at trying to implement strategies to reduce the falls risk for those frail clients. Medication management, so regular medication reviews, so looking into your GPs and other allied health there to see if there is any consequences of taking medications. So if there's any side effects that you're experiencing that will lead to more of an increase in falls and those sorts of things. We want to optimize your nutrition levels, so ensuring that you're eating adequate calories, protein, all those sorts of things to promote more muscle growth and development. And then again, social supports. So providing social support and addressing unmet social needs can improve the well-being and adherence to care plans. Okay, so whilst age is a common link to frailty, early intervention can allow people to continue to live healthy and active lives. And then, yes, that's why today, this program, essentially we're trying to just educate you in a little bit more further ways that you can help manage this at home and in the community. Okay, so in terms of the literature on frailty, there is quite a bit of studies that have been conducted, and essentially some of the studies have suggested that exercise can positively impact cognitive function in frail older adults, potentially delaying or preventative cognitive decline. It can improve your emotional well-being. So just by being out in the community, exercising with friends and groups will be a positive impact there as well. It can improve your physical function. So exercise programs specifically targeting strength, balance, and aerobic capacity can lead to improvements in your overall physical function, such as your walking, your gait speed, your grip strength, so your upper body function there as well, and which are all key indicators of frailty. Exercise can also reduce inflammation. This is a key factor in development and progression of frailty. So if we can reduce that inflammation on the bones, the joints, you're going to be able to exercise and do more within that community as well. Reversal of frailty. So some studies have shown that exercise interventions can actually lead to reversal in frailty, meaning that individuals can regain all of their lost function and completely reduce their risk of falls and other negative health outcomes that are also linked to frailty. We've got a delaying onset of frailty. So as mentioned, it is reversible. Okay, so we also want to delay the impact that they can have on our bodies. So those that are at risk, we want to help maintain the independence and quality of life. So things like this exercise interventions will be significantly beneficial to those clients. Now, in terms of exercise recommendations, for individuals experiencing frailty, exercise recommendations focus on strength, balance, and aerobic training. We're looking at a gradual increase in intensity and duration over a period of time. So essentially, we're looking at starting with a low to moderate intensity exercise, incorporating resistance, balance, and aerobic capacity, which will help improve your overall strength, your ability to perform activities of daily living, and reduce the risk of falls and other things like that as well. Okay, so in terms of the benefits of resistance exercise, so resistance exercise is essential for maintaining and building muscle mass, which are crucial for maintaining your mobility and your overall function. What you want to do is you want to focus on exercise that engage the major muscle groups. So things like body weight exercises that are going to incorporate a lot of compound exercises. So exercises that include lots of different muscle groups, such as squats, lunges, push-ups, and those sorts of things will be beneficial. Obviously, this would be tailored to the individual through an exercise program. We can also utilize things like resistance bands, some free weights, so some dumbbells or some barbells if you do have those at home as well. If you are more inclined to want to get out into the community, things like the use of machines through gyms and active aging classes can be utilized as well. And then, yeah, this is going to overall promote muscle strength and function. Now, in terms of the resistance training, it is highly effective. It's a highly effective strategy to improve muscular strength, function, body composition, and reduce the onset of frailty. So for those with pre-frailty that are more open to developing that condition, strength resistance training is one of the best things to help delay that and also reverse it. Okay. In terms of this, we also want to conduct it resistance training 2 to 3 times a week, ensuring that we do have rest in between our sessions to promote more muscular promotion and recovery. Okay, so on this slide here, I've just got some examples that are things that you can do at home to help promote that. So essentially on the bottom left, we've just got a squat, okay, with a dumbbell. Okay, so this person can just utilize this at home. If we were to look at the bottom right, a regression of that exercise would be just a simple sit to stand. So utilizing a chair at home, you can have a use of a bench or something there to help you stand up as well. But we're looking at just trying to promote your strength in your quadriceps and your glutes as well. So looking at those compound exercises that are going to promote more function there and strength. Okay. Another option is obviously we did mention the fact that there is push-ups are a really good exercise. Okay, the top left screen, we do have the person conducting push-ups on their knees, okay, to try and promote more chest, so upper body and their triceps, all useful for transferring and those sorts of things. If you weren't able to do that, a simple regression to the right-hand side would just be to do a wall push-up or a push-up off your countertop or bench at home as well. Okay. In terms of utilizing resistance bands for that resistance training, the person on the top right of the screen there, they've just got a TheraBand, which you can pick up from most of your local stores in town, and they've wrapped it around a table or a chair, or alternatively you can have someone hold on to it, and we're just conducting the leg extensions and hamstring curls, which again under resistance will promote more muscle growth. Okay, so now we're going to move on to a bit more aerobic exercise. So the importance of aerobic exercise is we want to improve cardiovascular health and endurance, which is important for our overall well-being. Okay, we want to increase your heart rate essentially through these exercises and movements. So things like low impact exercise such as walking, some swimming, or even some cycling is highly beneficial in that area. In terms of the duration, we're looking for at least 150 minutes of low to moderate intensity exercise in regard to this. Alternatively, we can look at 75 minutes of vigorous intensity exercise. So in terms of the low to moderate exercise, that is exercise that you are able to perform having a conversation with someone. However, when we're working at that vigorous level, we are not able to hold that conversation. It's a little bit more, you will become a little bit more breathless and those sorts of things. So again, it's very important that this exercise is very tailored to the individual and their capacities at the time. A lot of these exercises, we're looking at enhancing your VO2, your peak performance there. So it's just essentially the maximum oxygen uptake that you have. So yeah, trying to promote more blood flow, which will help in that regard. It will increase your endurance as well. So aerobic training can increase endurance in frail individuals, allowing them to perform activities for longer. So particularly if you are finding that throughout the day you struggle to do more and more, endurance and aerobic exercise is very important to help you promote that capacity and to allow you to perform more activities of daily living at home. Okay. And another one as well is just improving your overall heart health. So, so then we're less susceptible to developing cardiovascular disease and diabetes and those sorts of things as well. Okay. On this slide here, I've just got some examples. So a common question is, you know, I do a lot of gardening. Is that going to be working that sort of aerobic capacity? And yes, to a degree, it will. It obviously will depend on what gardening activities you are performing. But yeah, stimulating that aerobic capacity there. And yeah, that stimulation will be a good aerobic exercise. Some more common ones, things like walking, okay, and swimming. All right. So in terms of in those, it can be just a light walk. If we're looking towards a bit more of a vigorous intensity exercise, we could be doing like a bit of a brisk walk, or we can do some more sort of intervals. So we could pick let's say if we're walking throughout the street, we could pick a light post, walk to that one. The next one, we can walk a little bit quicker, and then we just alternate. So we're just going back to a lighter endurance pass there. Okay. Another one that's very important for frailty, sorry, is balance. Okay. So one of the main things is that falls risk. Okay. So those that identify as being frail, we do want to prevent a falls risk, because we don't want to have fractures and longer hospital visits as well. Okay, so balance is crucial for improving falls and maintaining your stability, which does naturally decline as we age. So just some examples here. We can focus on exercise that challenge your balance. So things such as hill raises, so standing with your feet flat, raising up onto your toes, toe raises, so just doing the opposite movement, tandem walk, so you can pick a line, do some line walking, so having just one foot in front of the other, and Tai Chi. So it's another form of gentle exercise that improves your balance and coordination. One of the main things here is with your balance, whilst we want it to be challenging, we also do want to prevent the risk of falls. So things like mobility aids and chairs and supports are highly recommended in this area. All right, so here I've just got some examples as well. So obviously there's the Tai Chi, so just some gentle movements there that's going to essentially work that coordination and a bit of balance and stability. Another example, so directly below that, the gentleman walking next to the line. So something simple as that, you could just pick a line at home, preferably in the hallway or so you've got some supports around you. If not, if you've got a mobility aid, you can use that as well. And just trying to walk in a direct straight line there. Alternatively, there's the person to the right on the bottom right of the screen. They're just conducting a tandem balance. So for that task, you would just stay stationary. You can have your hands near a chair for supports as well if you need. And then, just trying to hold that for at least 20 to 30 seconds. The top right, we've just got someone performing what we call a star drill. So essentially, you don't need to mark out the star, but it is a good idea to do something like that, because you're just going to essentially tap on different areas of that star, which will also include a bit more balance there, and will really work on the stability of your ankles there as well. So we've sort of mentioned a little bit of the intensity and duration. However, the most important thing that we really want to focus on is that a lot of these programs and things that we're doing should be individualized. So we want to start slowly. Okay, so we want to begin with a low intensity exercise and gradually increase the duration and intensity as you get stronger and as you get more comfortable with those exercises. You need to listen to your body as well. So pay attention to how your body feels during the exercise and stop if you experience any pain or discomfort. You need to consult your healthcare professional when undertaking some more complex exercises. It's always a good idea to talk to your doctor and your physical therapist before starting a new program, especially if you have any underlying health conditions. So like I said, we want to decrease the risk of falls and improve our frailty condition. So yeah, things, if there's any other health things such as cardiovascular disease and those sorts of things, it is recommended that you do consult your doctor prior to undergoing the programs and the exercises. Some more considerations that we do have as well is that, you want to prioritize your safety. So that's, really starting slow, ensuring that you have an adequate warm up and a cool down after exercise. So in terms of a warm up, we're looking at sort of dynamic movements. So that's things like some squatting, some just walking, those sorts of things to promote that blood flow initially. And then a cool down after you've exercised would be looking at more static stretching. So that could be simple as sitting on a chair, performing just some hamstring exercises. So just gently leaning forward, touching your toes, and holding those for, again, 20 to 30 seconds or so. We want to focus on functional activities. So as mentioned, we want to use compound exercises, so those that use a lot more muscle groups. So incorporating exercises that mimic everyday movements and replicate sort of that activity of daily living. So it'll help you when you're performing things in the garden, or if you need to go shopping in town and those sorts of things as well. Whilst you are exercising, it's important to stay hydrated. So drinking plenty of water before, during, and after exercise, just to, again, promote more blood flow, increase that promotion of, just reducing that impact on the joints. So it'll help allow them to move a bit more freely as well. In terms of your nutrition, just eating a balanced diet. So if you're not sure about that, it is recommended that you do see a dietitian that can help you plan that as well. Social support. So consider joining group classes or finding a friend to stay motivated. It is a big thing we want. Once we get started, that's the hardest part initially. So if you can find that support that's going to motivate you to get exercising, then that's the first step. That's really important. And then with your supervision, consider supervised exercise programs for better adherence. So this may be in active aging classes, those sorts of things. Alternatively, if you are performing exercises and movements that you're not quite comfortable with, just having someone around, whether that's a family member or a friend that's around there. So if you were likely to have a fall, you're not left on your own there. Okay, so that concludes our Frailty talk today. I've just got some references as well in terms of a few of those studies that we've been looking at. So if anyone's interested, you can have a look a bit more through the literature on that topic. Okay, thank you. Back to you, Jake.
Big thank you to Steve for your presentation today. I hope we all found it very informative. I know I did. And thank you.